Okay, a few minutes past the hour, and I think we are gonna get going. So, very welcome to this webinar, where we're gonna talk about how language can build alliance in healthcare. And I have some very interesting people with me today, Linus Kullänger and Jonatan Haile, both medical doctors, and we're gonna talk to them a little bit more. But before we do that, I'll go through the agenda. So my name is Ellen Allison. I work for Care to Translate as a Chief Commercial Officer. And we're going to have this webinar where we talk to Linus and Jonathan in a panel. You can always ask questions in the chat. So do that during the meeting and I will do my best to pick them up. And then at the end, you're also going to get an intro and demo of the solution Care to Translate. So before we start, I would like to ask everybody to think about the question that's in the yellow circle down to the right. What sentence would you like to know in every language? If you could choose one sentence, what would it be? And then you can write that sentence in the chat. So let's get started then, and let's hear from Jonathan and Linus. So let me introduce them. We have Linus Kullänger, who works at Södersjukhuset. And could you start by telling us a little bit more about you and what led you to work in healthcare?
My name is Linus Kullänger. I'm the former CEO of Care to Translate, one of the founders. What made me work in healthcare, I think, is one of the main reasons is that I really love to get close to people really fast. I think it's like a privilege as working as a doctor or assistant nurse or anyone in healthcare that you can get close to people really fast by just being with them. You ask them very private questions. You can help them with things. You feel needed in a very special way, and you know that you do something important every day. That is the main reasons why I wanted to become a doctor.
Very good reasons, I would say. So, and what firstly made you aware of the role that language plays in patient care?
So actually, I did not think about that so much until when I started the medical program, I got placed in a primary care unit in Södertälje, which is a city in Sweden, where it's a big portion of the community speaks Arabic, because of lots of immigrants who come from Iraq during the 90s and early 20s, and then also during the early 10s. And I came to this primary care unit, and I think like maybe half of my patients, half of them spoke Arabic and did not speak a word of Swedish almost. And I just realized that I lost like my main tool as a doctor to talk with the patients, and that was a huge like wake up for me. So that's how I came into it, because I felt like I lost. I don't know. I didn't really know how to like approach them in a normal way, and that made me feel, I don't know, helpless in a way.
Understand. And then I'm going to come back to that and how you then work to actually address that challenge. But firstly, I want to let Jonathan into the conversation as well. Could you tell us a little bit about you and what led you to work in healthcare?
Yeah, so my name is Jonatan Haile, and since I was a child, we knew a pediatrician, a friend of the family, so I had him as a role model. I also wanted to become a doctor. And I also know that, similar to Linus, I think that the main big aspect of being a doctor and working in healthcare is the communication with the patient. And I just love the thing of being able to help people and being close to people. And I think I also see the same thing by speaking different languages. You really connect to people in a way that when you speak to their native languages that you wouldn't do if you don't.
Yeah, because I've heard that you speak 7 languages. That's quite amazing. How did that come about?
Yeah, so it's interesting story when I talk about it. It's like when I grew up, I was a bit shy and not like I am today. And I had an older sister, 2 years older, and she was more outgoing and speaking a lot. So my parents are from Eritrea, so we heard Tigrinya at home. But since I was speaking much more observing, they thought that, oh, she is the language person, I'm the math person. So that's what I thought also. And then you get this into your mind. But then when we could choose a second language, or apart from English, we could choose either Spanish, German, or French when we were 6th grade. I remember I had a really good Spanish teacher. He was so enthusiastic, and I just thought it was so fun. And I understood that I really have fun learning languages. And when you have fun, it's like accelerates everything. And I really understood that it was easy for me to remember words and playing with languages. And then it just continues. So Spanish was my favorite subject in school. And I used to play the guitar and sing, write my own songs. And through music, I also learned a lot of new words. And then I also went abroad after high school to study Spanish at university in Spain. And then I also studied medical school abroad in Hungary. And I also learned Hungarian fluently. It's a very difficult language, but once you learn it, it really makes a difference. And then I have done some other language since I came back to Sweden to work as a doctor. I missed the feeling of being able to surprise people by speaking to in their language that they wouldn't expect. So I knew another artist that I really liked, a Russian artist that I used to listen to. So I started with Russian and did language courses online and went to language cafe, and then just continued. So I got a better high level of Russian, and then I also thought that Arabic is very useful in Sweden, especially with the patients. So I also started with Arabic, with Egyptian dialect. I wouldn't say that I'm on the same level as with my Spanish and Hungarian Russian, but I can communicate, and I'm trying to improve also some medical vocabulary there.
Wow, that is really, really amazing. And how would you say that it's influenced your work as a doctor, knowing these many languages?
I would say that it's almost like you see another side of the patient, like a nuance, because through the language we see them not only as a patient, but their whole person. Like you can decode a lot of situations when you speak to them in their native language. And it has made it even more like meaningful to be able to come closer to the patient by speaking to their language. And I then not only become the doctor, but also a human being that is connecting to them through the language.
Yeah. And Linus, you said that you kind of lost your mojo when you couldn't really speak to patients that didn't know the same languages as you. And then you went ahead and you did something about it. Do you want to tell us a little bit about founding Care to Translate?
Yeah, actually, like I'm pretty jealous to
Me too.
Jonatan. Yeah, because like the first instinct was for me to like, okay, how do I solve this? It's because like I wanted to learn Arabic. That was like the first solution for me. So the first thing I did was actually to start learning Arabic. So I went to also went to language courses, and I did Lebanese Arabic instead, not Egyptian. So the Lebanese dialect. But I'm not blessed with the same brain as Jonatan. So for me, it was really difficult to learn Arabic, but it's also been difficult for me to learn like Spanish and French in school. So I realized quite quickly that this was not a good solution for me. But I also realized, because like time went on, like maybe the first time I was in the primary care unit was 2013, and then I then like 2015, and there was a big immigrant crisis in Europe, and then like the problem became very obvious that that like language barrier was not only something I experienced, that because of my lack of language skills, it was something that a lot of us working in healthcare lacked. So we started up. I created like a sheet of words that you could have like in the pocket. Some phrases that you could say like hello, how are you? I could tell patients what profession I had, ask them very simple questions just to get closer to them. And it was maybe like in the beginning, I don't know, 10, 20 phrases. And we translated them first in Arabic and some other languages. And it worked really well when I used the translations on the paper I have with me. I remember, like Jonatan talked about, like the surprise you get when you talk to a patient. The first one I had, like mind you, I learned Lebanese Arabic, and Arabic is a big language. And the first patient I tried this with was a Moroccan patient from like countryside. And we had a big. He was pretty sick. He had swallowed too much medicine, a whole bottle of this bottle of Coquelana, which is a cough medicine, and he thought that like he I don't know what his illness really was or why he was sick, but it was not like I don't know if it was coughing or anything, but like he said, okay, if I take more medicine, I get healthier. So like he took the whole bottle, and that made his kidneys crash. So he was really really bad. But then I went in with the room, and I presented myself and the other doctors in the room, and he was like, you could see him. He was really surprised because he recognized some of the words. Most, like, he didn't really understand me, but he got so happy because like I tried to say something in Arabic, and after that I think it was a lot easier for us to talk with him. I believe that we got a lot more trust from him, telling him like why we thought he got sick and what he should do further on when he got out of the hospital to treat himself. And I think it was actually a good breakthrough. So that was the start of it. And now I'm still in the beginning, but I did this phrase. We tried to produce more of this phrase lists, but you needed more of them, more phrases to add on. I also wanted, like, I had some phonetics written on them. I wanted some sound to hear how actually like the words was pronounced. So we decided, it was a group of medical students, we decided that we could build an actual application for a phone, so we could like click on a phrase and then hear how it sounded, and that would be much more agile or easier for people to use, and then you can add the phrases further on when you need them. So first it was maybe 20-50 phrases, and then just adding on. I don't know, now it's like the Character Translate app is up to 3,000, I don't know, phrases.
I think it's more than 3,700 actually.
Yeah, okay,
yeah.
Yeah.
So yeah, the lots of phrases. I'm gonna kind of ask you. So both of you, I mean, Jonatan, you know 7 languages. Do you ever run into language barriers still? And to both of you, then, how often do you actually run into these barriers?
I mean, part of language barrier is not the languages that I speak, though.
No. Then there's not barrier for you, I guess.
Obviously, a lot more.
Yeah.
Well, yes, that happens. It also depends on where you're working. Also, I was in other hospitals in Stockholm before. For example, I was 3 months at the infectology clinic. Then there was a lot of patients who speak different languages. And it is difficult. Yes, you can really see how language barriers affect their health, healthcare, and how it also many times can risk of misdiagnosis or more examination than you would need or less. So it can be very, very difficult thing because we get less information from the patient.
Yeah.
Yeah.
And Linus, then, how often would you say that you run into these barriers today working in Södersjukhuset in Stockholm?
It is very different, like depending on where I'm placed. But right now I'm in the emergency clinic or in the emergency department, and I would say almost every day, sometimes several times a day. But mind you, I'm not as Jonathan, so. But still, it's often, and you know, it's not often. It's like it's a gray scale of how much language barriers you have. So sometimes it's patients that know some Swedish or some English, but you have to you always have to calculate how much do they understand me and how much can I trust what they say, do they really understand, do they really know how to speak Swedish, or do they know how to translate their symptoms to Swedish really. If I ask them questions about symptoms, if they have pain, what kind of pain, is it a burning sensation, or is it something is pain radiating somewhere, it could be very difficult to really understand if they know how to express that. And also it's also very different in different languages of how you actually describe your pain. I don't know, Jonathan probably knows more about that, but that is something that occurs a lot often. So I mean, every day there's some language barriers for me.
And I also add that it also can be like maybe some of them will be ashamed because they're not can show that they didn't understand. They can come from country where they have big hierarchy from doctor-patient relationship. So maybe you think that they would understand, but they didn't. So that's also, as you're saying, like we have language barriers on different levels. It's not only that they don't speak a word, but maybe they can speak, but they don't really fully understand it. That can make a big difference too, as you would think that they understood what you said. So it's a communication problem.
And what would you say, I mean, a question for both of you then, what would you say are the consequences of you feeling unsure if they have understood, or what kind of, how do you act in the moment then if you're unsure if they've understood what you're actually saying, if it's a stinging or burning sensation, or when you are in the situation?
I mean, for me, it's like now I took a pause in my medical working as a doctor, studying as a medical student. So before, we would definitely have an interpreter always, if that would be like a very like a tipping point, or very would be very, if the questions that we wanted answers would be like decision making important, then we would have a interpreter, or you would take more tests or do an X-ray or something like that. And that is sort of how it works today as well. Like I work a lot now with different types. You speak Swedish, you speak English, and then I use Care to Translate. I use interpreters. But if I'm unsure about a phrase or a symptom, then I use Care to Translate for with the verified phrases in the languages that has verified phrases. I can ask about like specific symptoms. But still, if you're unsure in any way, so let's say it's a child, and you can almost never trust a young child describing his or her symptoms. So normally you take more tests and you do more radiology. So that is often a way to go for doctors. When you're unsure, you do more examinations, more tests.
Yeah.
And more examination, more tests is not always the best, because that also can be there risks of too much radiation or taking tests that doesn't really is addressed to what the real question is. So it can be even harder, and you maybe take more tests from these more tests, and it put like a loop. That's also a problem. So yeah.
And
So I
they're
guess
very stressed here in the emergency department. They're quite stressed about, how long the patients should be in an emergency department. Of course, it's very stressful for patients to be in an emergency department because, like, you don't want to be there a long time, and a long time. Sometimes it's like waiting times for. You could be there like 12 hours, but there's like you get like in Stockholm or in Sweden you get a fee from I don't know where it comes from, if it's from the region or something, if the patient is in the emergency department more than 4 hours. And like if you have any radiology for that patient, then of course that time is extended. So that is also, of course, like it costs money for the society as well, in many ways, but also for the patients, definitely.
Yeah.
And the anamnesis, that like the patient history is like 80% of the diagnosis. You used to say, like, it's so important to get it correct and not just try to do more tests and more radiological examinations and everything, because we need to use our biggest tool, which is the way to talk to the patient, and that's very crucial.
So and therefore I'm guessing, do you Jonathan find yourself in a situation where you have to go in and translate for your colleagues?
Yes, that has happened. And what has happened also more is that since I'm like a doctor in internal medicine, so it's quite broad. It's almost like a GP, but in a hospital. So I can also take a lot of different symptoms and like diagnosis and treatment. So sometimes my colleagues would come to me and say if there's a patient that would come to the outpatient department, ask if I could be the doctor for that patient, or if it would be at the ward, similar thing, and also maybe at the emergency, then I will just help to interpret at that moment. But I would say that I think it's better to be able to do directly as being the doctor and being the one who speaks to them in their languages, because you will get the direct from the patient. You can really, I feel there is a difference there in that, not using a third person. Because some things can get lost, and you can be more effective, I think, because you know yourself what you want to say and you say it in that language. So
yeah,
I think but yeah, it's not so easy for people to learn all the languages that exist and
no,
still
of
being
course
a
not.
healthcare worker.
And also we're kind of in a multilingual society. That's just, people are traveling more and more. We're getting more and more exposure to different languages. And I guess, I mean, human connection, we've kind of established that that's super important in healthcare, but also we have then technology and innovation, and how these two kind of go together. So I guess if I ask Linus then, what role do you think a digital translation tool like Care to Translate can play in bridging these communication gaps?
I think it would be like a major leap forward, because I mean, let's say if you go back 10 years ago, then you were almost dependent on an interpreter. And if that wasn't available, let's say in some languages that we did not have much interpreted from, let's say Albania, in the middle of the night, it was impossible to get an Albanian interpreter. And if you had a patient in Albanian speaker, it was impossible to talk to that patient. And it's not a nice to have thing, like a translator. It's really like a vital thing to have. As Jonathan said, it's 8% of the 8% of the doctor's examination is anamnestics, but I can't speak English either. But you know what I mean. But it's also, you need somebody just to say a few words to calm the patient down, to tell them what's happening, guide them through the healthcare. I mean, the information you give is just a few words, or just the caring is so important. So back then it was almost impossible, and now you see that the drive to use digital translations, I often see this from the patient side. Like, they come with like Google Translate or other types of translation apps to the healthcare, because they are used to using them in all types of situations in the community. And now, like, the AI powered translation apps are getting better and better. So I mean, in the future, hopefully we will see a more even better translation tools in the future, and also for languages that are like neglected, we call them sometimes. For example, like Tigrinya, which Jonatan speaks. It's a big language. A lot of people speak. More people speak Tigrinya and Swedish, I think, and but still, it's not really available in an AI translation tool. So you're like completely dependent on either an interpreter, family member, or like character translates to be able to translate for them.
And when you have used the app today, have you, with patients, what has surprised you the most in terms of using it and the reaction you get from patients?
I think like what surprises me the most is that how easy it is to get forward. Like usually when I use it, it could be like it's two situations. One is to talk with them, like longer talks to get anamnestics, like the patient's history. And then it's more fluent. I use the like live translate function, but then a lot of the times, you forget the question. You want to ask something more, or you want just to say one thing. Let's say the patient is going to the radiology, and you need a weight, and you haven't like you don't know the weight, and you have to ask about the weight or something like that, and you just like use one question, and just like the thing with how effective a few phrases can be is something that actually impresses me the most, both in like the way of opening up to a patient, something you can say, a phrase you can say to them that surprises them, and bridges or like increased alliance to the patient, and also just to get forward with the healthcare they're given. So something that you need for different decision makings.
I've also noted that how important some specific phrases can make a big difference in the patient, how they understand the situation. Because I used it once when it was not my patient, but it was a patient who was in the hospital and had to go to a psychiatric clinic because they had this psychiatric symptoms. And the wife of the patient came and just looked at me and started to speak Arabic just by that, because they thought that I would just speak it. And then I was proud. I can know some basic Egyptian, and then I was like, okay, let's focus. And then I tried to explain to her, but it was very difficult because she said many times that he's very nice to me, like, because in some cultures, maybe in some languages, maybe they would have a different view of what it means, like a psychiatric disease. So she's trying to say that he's so kind, and what happened to him, he was never bad to me. And then I just used the psychiatric questions, and no, not questions, the statements, and that just looked at her face, just like understood, like almost like just a sentence. That I think it's sometimes we just translate word as it is directly, it doesn't really make the same thing, because languages and cultures have different ways of viewing things that as we are seeing it. So it was interesting to just see how a sentence could make a difference.
Mm-hmm.
Yeah. And if we're trying to kind of look ahead, it doesn't look like populations will travel any less in the future. We are going to have, the challenge is kind of here to stay. So what would you, if you could change one thing about how healthcare systems handle language diversity today, what would it be? Whoever wants to go first.
I would like people in this decision-making area really like. There in Sweden there's a law that says that everybody has to get healthcare in their language. But even though we have that law, it's not really abided. Like people don't follow it as they should do always. But I think it's very important for the decision makers to really try to implement that language barriers are not only like a accessory tool or something that you could. It's not an accessory. It's like it's one of the most vital things. It's something really deeply human to be able to communicate with the language as we do. And once you lose language, like the whole healthcare plan, it gets really unstable and shaky, and you lose so much in it. So I would say, like, as well as you do, like, as well as I use a stethoscope in my and as well as my bosses wants me to use stethoscope, I think that, like, language should be seen as obligatory to be able to overcome.
Yeah. And Jonathan, do you have anything that you think about the future? If the healthcare system had handled language diversity, what could be improved?
Yeah, I think we should have more time with the patients and less time at the computers. That's very important. And just this fact that you be able to speak some words in their language just make it completely different for the patient itself. So I think that's one thing. And well, if we just learn some basic phrases in the language, as Linus said, it also makes a huge difference. Well, I also think that people should learn more languages, just because amazing it is to be able to grow as a human being and connect. But yeah, we should focus more on being closer to the patient and less with the computers, I think.
Yeah. And
I
then
agree.
finally, then if you could give one piece of advice to healthcare professionals today who works in a multilingual environment, what would that be?
I would say that you should always try to think of the patient that you have language barriers with as the exact same patients that you don't have language barriers with. Like, you should treat them in the exact same way. So if you don't understand, ask more. And then you always have to, like, as a doctors, we are schooled to always ask them in the end, like, so what did you understand? Like, follow up. Can you tell me about, like, what are we going to do next? So you really know that they understand what we have talked about. That is very important, even more important maybe, to ask when you have language barriers with patients.
Yeah, I agree that we all are the same. Like, we need the same treatment, and language barriers shouldn't be the fact that really makes a difference. We should actually try to give them all a chance to be able to get the same kind of health care that we give the rest.
I actually also agree, even if I'm not a medical doctor. So the very last thing I'm going to ask you, we need to wrap up and get into a little demo at the end. But the same question I asked the audience at the beginning: if you had one sentence that you would know in every language possible, which sentence would that be?
Wow, good question.
I actually have one. Sorry, Jonathan, go first.
No, I don't think. It should be something fun. I think always it's the best thing of, like, when I'm learning language, I'm trying to find some things that is very specific for that country or the culture, and that people will be like, oh, that you know this, you know. So maybe that's not a universal thing, but Linus, maybe you thought about.
No, I actually have one.
Sentence.
It's not a sentence, but it's a phrase that I try to learn. It's like, I know in some languages, and it's hurry, hurry. So I know, like, you say like yalla yalla in Arabic. You say haide haide in Bosnian Croatian, Serbian, and you say in both. I learned actually last week. I learned it in Bengali. You say cholo cholo, like let's go. But you also say that in Urdu, I think, or in Pashto, I don't remember. But that's a fun phrase, because, like, you shock people sometimes, you know, like you like, especially when you have a patient, you go get them in the waiting room, and you like yalla yalla, or you do like cholo cholo or something like that. They're like, what? And it's a icebreaker in some ways.
Yeah. Actually, I asked that question. And I spoke to some people within radiology, and got some different, like, sit still, breathe in. But I also got a very, you can say grounded, hello, my name is. And we also have some in the chat here. Do you have any pain? I guess that's also a more kind of important question to be able to answer. But I want to thank you, both of you. Very, very interesting conversations. I'm going to keep on going now, but just quickly introduce, I have a few minutes to introduce Care to Translate. It's a super easy app to use, so I think I'll have plenty of time. So you can stick on the line, guys, if you want to. And I'm going to share my screen again. So let's see. Yes. So basically, we know that Linus, when he was a little bit younger, you can see here, he then founded Care to Translate by coming up with phrases that are good to use with his medical students. And then this has then developed to the Care to Translate app that we have today, which is then a medical translator for healthcare professionals made by healthcare professionals. Two main kind of areas in the app. It's the real-time AI translation, which we have then in over 130 languages. But then we also have the kind of pre-verified phrase library, and now containing over 3,700 phrases, then medical phrases in 49 languages. And this is then medical personnel. This is humans who have translated these phrases, so we know that they are correct in context. The app can, of course, be used on mobile, tablets, and desktop. And the big thing as well, which is important, is that no data is stored. So even the things that you will see in the live translates when we get transcriptions, that is text only stored in the device and never in any cloud. And when it disappears from the screen, it disappears completely. So I'm going to jump straight in actually to demo the app since we don't have that much time left. So let me share my phone screen with you. Right, so here I'm going straight into, now I think you can see my screen, going straight into the live translation then. So you might have seen other AI translation tools, Google Translate, for example. This is a fairly easy one where you just speak into the phone. Right now I have the patient language set to Polish, that's the right-hand side, the blue, and English as the staff or my language. So first of all, I'm going to change the language to the patient language. We talked about Arabic before, so I'll press Arabic. We talked about dialects as well and how it could be challenging when you know a different dialect from the patient. So here we have now support for 16 of the most common dialects. So I choose Iraq. I know that we spoke about that one before. The one I'm talking to, my patient is female, so I'll go on and press female. And here, now I can just speak freely into the phone. So I hit the green microphone. Do you have any family with you today?
هل لديك أي عائلة معك اليوم؟
So now it spoke Arabic and I don't know Arabic. So I don't know if what's translated is actually accurate. So therefore we have a reverse translation feature, which I think is absolutely really good to use. And I get to that by pressing the arrows next to the blue keyboard. And here you can see what I said, and then you can see what the translation actually became. And this is correct. So I'm happy with this translation. If we try another one then. Do you feel hot?
هل تشعر بالحرارة؟
And then next to the keyboard, I pressed the reverse translation. And then it came up, do you feel the heat? And here I can choose, because now that's not what I meant. Do you feel the heat can talk about the weather, it can talk about the temperature in the room, but I was after, do you have a fever? Do you feel feverish? So here I know then that I have to rephrase. So then I go back and I say, do you have a fever?
هل حرارتك مرتفعة؟
And now you see that I got a blue box around the translation. And that's because this phrase is actually a medical phrase that's already consisting into our phrase library. So this translation, we know it's accurate. So here one of the 3,500 plus phrases that we have, this is one of them. So here you don't need a reverse translation because you know that this is correct. And I'm now going to show you, you can also, of course, have the patient speak back to you, but then I have to change the language to Swedish because otherwise I'll Swedish. Voice. Now the demo ghost has Swedish. There we go.
Har du feber?
And then I can ask the patient to respond straight back into the phone. Ja, jag tror det.
Yes, I think so.
And then you can keep the conversation going. So that's the live translate, basically what it says on the tin, so nothing surprising. If I go to the home button, here you find the phrase library. So this is now set to an emergency setting. So if I work in an emergency, for example, in a hospital, I could use these phrases. We have pre-populated many different areas of healthcare. There is, radiology to mammography to, we have like nearly 100 different areas of healthcare. We had lists then appropriate for that area. So how do you use these lists then? These lists are very good for routine care. When you have triage, for example, you ask the same questions to each patient. Nurse examination within emergency care. Here, I'll press that one and you end up in a list. The difference here is that you don't have to talk into the phone. You can just hit play, but Swedish is a bit boring because I think some of us know Swedish. So let's go for Polish instead. I'm speaking to a male this time. And then I can just press play on the phrase.
Proszę zdjąć ubranie od pasa w górę.
So this was then for the examination, please remove your clothes from the waist up. And then there's also an image that supports what I'm trying to say. Then you can go further down in the list. And you can ask, for example, this is a very popular one within healthcare, the pain question. On a scale from 0 to 10, how much does it hurt? So I can just hit play.
W skali od 0 do 10, gdzie 0 to brak bólu, a 10 to najgorszy możliwy ból, jak bardzo to boli? Proszę pokazać liczbę na palcach.
And then straight in the list, you can also have the patient answer you back with pressing the number that it's in. You have also an opportunity to have the patient answer you back within the list. So do you need pain relief? I can hit play on that.
Potrzebuje pan czegoś przeciwbólowego?
The patient can say yes or no, but can also hit the microphone. Tack.
Yes.
And now you're back in the live translate, so you can also, the patient can interact with you in that sense as well. I don't have time, I think, to go through all the other, but that's the main features of the app that I wanted to show today. So I hope that was, that you understood and that you saw that there is a lot already in the app for you guys to use. The most important thing to remember is that it's safe to use. There's no patient data ending up anywhere where it shouldn't. You have both live translation and the phrase library. So it can make you a lot more efficient, and it can also help you communicate with the patients, which I think both Jonathan and Linus pointed out being the most important thing, to be able to communicate with your patients even when you have language barriers. So I want to thank you all for listening today, and I hope to see you next time.
Thank you.
Thank you. Thank you. Bye-bye.